Good morning. I'm Bob Sanborn. I'm President and CEO of Children at Risk. We're a statewide advocacy and research group, and we're here to talk about what's going on in terms of sleep in the state of Texas, and specifically here in the El Paso area. One of the things that we know is that across our state, there are a lot of children that are sleeping insecurely, and we know that that has a dramatic impact on their academic success and their health success. So we've put together a good cast of characters to talk about this issue today. Some experts in this field and some experts in the area who are dealing on the ground with children. I'll start with Sharon Jones, who's the Chief Equity Officer at Children at Risk and also the Director of the Texas Racial Equity Collaborative. Good morning, Sharon. Nice to have you here. Also with us is Mauricio Martinez, who is the General Manager of Mattress firm in El Paso. Mattress firm has been a great partner with Children at Risk on this particular issue. Mauricio, thank you very much for being here. Also with us, Sharmali Roy, who is the Director of the Center for Social Measurement and Evaluation at Children at Risk, and she's the primary author of the study. We'll get into a couple of the details with Sharmali. Also, Dr. Veronica Vigil, who is the Superintendent of Fabens Independent School District. Veronica, thank you very much for being here today and to give us your insight on the schools. Also with us is John Adams. He's the Director of Health, Wellness, and PE with the El Paso ISD. John, thank you so much for being here. And then finally, para la prensa latino, Guadalupe Fernandez is here with us from Children at Risk. She's the Director of the Children's Immigration Network. Guadalupe and I will have a brief conversation at the end in Espanol for la prensa latina. The first thing I want to mention today as we do this release is that all of us understand that sleep is important. And I'm sure we had someone in our family, someone in our life who would always say to us, in my case, my mom would say, sleep is one of the most important things you can do, get good sleep. And, you know, we knew that to be true, but I didn't always listen to her. And I think that's the case with sleep right now, is that we know that it's important for our success, but we don't always listen to that and we don't always put that into impact for our kids, right? We don't always put it to work for a high positive impact for our kids. What we found in this study is that there are a significant portion of children in the state of Texas and here in the El Paso area that are sleeping in sleep insecure environments that aren't necessarily conducive to sleep, and they live within an environment that is making it difficult for them to have that sleep and that success in life. We have put together some maps that are available. We'll put in the chat box, maps that will show zip code by zip code, those zip codes where we see significant insecurity in regards to sleep, and where we know that there are many children that aren't getting a good night's sleep within those areas for a range of reasons, which I'll explain. So we're looking forward to seeing those maps. But study after study, when it comes to sleep, find that kids who don't get study are much more likely to have health problems, or kids that don't get good sleep are much more likely to have health problems, including being obese, health problems in terms of mental illness, and are much more likely to engage in risky behavior. We also know that many times pediatricians will understand the importance of sleep, but aren't often engaging with kids and their families around the need for better sleep and more secure sleep. We also know that when it comes to public policy, a lot of the changes that fight poverty are important in regards to sleep, but we also know things around timing, when school districts start their schools, whether it's elementary, middle, or high school, but also daylight savings. You know, the whole idea of daylight savings or daylight standard, it's not so much when that happens, it's that the change in the time has this negative impact on kids, and we'll be able to talk to a couple of our school officials specifically about some of that. Our study looked at 11 different variables when it comes to determining where these sleep insecure areas were in our state and here in El Paso. We looked at family and child poverty. We looked at shift work. How does shift work impact these children? We looked at crowding in the homes, the Texas Education Agency's mobility rates. We looked at student homelessness, which is significant. Also, we looked at health factors like obesity and mental health and food insecurity and hunger, the disabled child population. And also we looked at the young people and how they're working and what does that work have an impact on the sleep deserts and on their success. What happens when kids don't sleep well in Texas? It's pretty clear, right? We know that they're less likely to be learning well. We know that they're going to have adverse health challenges as well. We also know that what it means for Texas is that the future for many of our little Texans and our younger Texans is not as bright as it should be when they don't get the sleep that they deserve. And many times when we look at sleep, we're looking at poverty with a different lens. We're looking at health with a different lens. But the idea is that for all of us to be able to see that this is a significant part of that success. And so when we start with parents, we start with recommendations for parents, because we know that parents are sort of our first line of defense when it comes to our children. They're the first responders. And so the recommendations for parents are really quite simple, but very, very important. Setting a regular bedtime is of utmost importance. The idea of spending a little time as a parent, as a caregiver with your child, reading a book or singing, even if it's the same book every night. Kids love this stuff, and they love this idea of just that quality time that settles them down before going to sleep. Taking a walk together earlier on in the evening or later in the afternoon. This idea of exercise and making it part of a family ritual is a very important. Eating together, eating dinner together whenever possible. Another thing that science shows is really important for the success of children. In regards to the sleeping environment, keeping it cool is an important part of the equation, but also making sure that screens, no cell phones or tablets going to bed with the kids, or even before bedtime, giving them time to quiet down. And then when it comes to babies, understanding that follow the safety advice from your pediatricians, right? And follow all the recommendations of your pediatricians. When it comes to public policy, a whole range of anti-poverty legislation, which is important, like the child tax credit. We know that kids who are not growing up in poverty are much more likely to be secure sleepers and to be successful. And so that they go hand in hand. And so following these anti-poverty measures is very, very important for our policymakers to really understand. I think one of the simple ones, which we're talking a lot about lately, is the idea of eliminating daylight savings or daylight standard, or moving to just one or the other with no changes. We know that changes have a real adverse effect on the kids. So we'll look forward to that. Specifically in El Paso County, we found that of all the cities in Texas that we looked at every major city in the state of Texas. El Paso was the third most sleep insecure region across the state. So we see significant sleep insecurity in El Paso. More than 24,000 kids in El Paso live squarely in a sleep desert, where we know that those kids are having a harder time with sound sleep and sleep that's going to help them be successful. And then when we looked specifically at a few schools that we just sort of wanted to raise the red flag, it doesn't mean they're bad schools. It means that policymakers need to be looking at these schools where there's high levels of sleep insecurity. Logan Elementary, Colin Powell Elementary, both in El Paso ISD, were schools that sort of rang out because of the mobility rates that they had, 27% and 23% mobility rates, very high. We know that those kids are going to have a harder time with sleep success. So as we look at all of this, and this study is our hope is that this becomes another way to look at the success of our children, of making sure that they're getting plenty to eat, all that they need to eat, which we've done a very good job in the state of Texas. There's always more to be done, but that sleep is another thing that could be very, very important for them. So Sharon Jones, maybe you could talk a little bit about the sleep inequity that we're finding across the state as well.
Thanks, Dr. Bob, and thanks Mattress Firm for this partnership. And we're able to shine a light on equity issues as it relates to sleep as a basic need and as a human right. Looking at factors such as socioeconomic status, race, ethnicity, education, family size, and structure all increase the risk of childhood sleep insecurity. And we know from this study that in Texas, where a child lives decides how well they will sleep. And without support for parents, families, and schools, children won't be able to develop adequately and in an equitable fashion. Neighborhood factors such as light, noise, pollution, crime, sense of safety, access to green spaces where they can exercise, grocery stores where they can have access to nutritional foods. And we also know that segregation in some of our neighborhoods in Texas stemming from historically biased policies manifest in sleep disparities. We were able to take a look at these things based on the sleep insecurity index that Dr. Bob shared earlier, with low socioeconomic status, sleep environment, and individual level factors. And we found that neighborhoods most at risk for sleep insecurity have considerably higher rates of low-income families, low rates of educational attainment, and we know that Black and Brown children in Texas were disproportionately represented in the highest risk communities. Of interest to this particular study, as we'll hear from some of you later, is that some of the schools are located in where military families live, and so there are higher proportion of their mobility rate. And so we'll talk a little bit about that with you later. But I think the most important thing for us to think about in terms of equity is the gap between those who have sleep security and those who are insecure in their sleep. And we need to make sure that those gaps are not insurmountable for families. And we'll do that through policies that help give our families the support that they need.
Thank you, Sharon, very much. Martinez is with Mattress Firm here in El Paso. And Mauricio, this has been a great partnership between Mattress Firm and Children at Risk in terms of looking at this. What drove Mattress Firm to want to be a part of this? Give us your take on this.
Thank you, Dr. Bob. Knowing that high quality sleep is critical for a child's long-term health and development, Mattress Firm is proud to partner with the Children at Risk on this project. The data that will be presented today confirms much of what we already suspected. Our children do not have equitable access to sleep. Okay, socioeconomic status, race, ethnicity, or the street they live on continue to have an undue influence over the quality and quantity of sleep children get. Okay, El Paso was the third most sleep insecure region in Texas for children. Okay, many of the sleep insecurities indicators for El Paso were above or on par with the state average. By addressing the root causes of childhood sleep insecurity, we set up our kids to be successful students, healthy adults, and effective workers. So thank you for including Mattress Firm in this important conversation. Now back to you.
Yeah, thank you, Mauricio, very much. We enjoyed every time we see a corporate citizen stand up for our children, right? It's an important thing. And all of us, including those of us who work in the schools, right? We understand it's a very important thing. So thank you very much. Sharmlee, as the primary author of this, Sharmlee Roy, who's the director of our Center for Social Measurement and Evaluation, as the primary author, what was the thing that sort of stood out for you most as you did the work?
So one of the biggest takeaways was that, that everybody is kind of echoing what everybody has also said, that sleep is such a basic, important need. It's a prevention against so many other issues in health in terms of outcomes and being able to long-term things like diabetes are all, linked to sleep as a child, and like being able to have adequate sleep throughout developmental stages that also have different ways of manifesting behavioral for little kids, such as separation anxiety and those types of things. It can also have different ways of manifesting in teenagers, like anxiety, suicide ideation, all of these things, and then being able to also have enough, balance of how they eat, like basically it's affecting even their normal sense of satiation and obesity rates in children affected by this. But one of the things is that we did go across before we did the report. When a part of our method was to go to different regions and ask questions and with social service and different child serving organizations and just kind of get their take. So we did come to El Paso. And one of the things that stood out definitely from El Paso that we didn't consider as much earlier, what would be measured, how would we measure is the binational kids, the kids who are waking up at 3 a.m. To cross. So the idea of how far away you are from a school definitely became a factor in terms of thinking about how does sleep affect children and then ability to then, sort of being able to thrive in the school setting as well.
Very interesting. Thank you, Sharmlee. There's so many little intricacies in this report that are just really striking. I want to go to Dr. Veronica Vigil, who's at the Fabens Independent School District. And Dr. Vigil, I wonder if you might, from your perspective at the school, I mean, obviously you're seeing kids that are sleep insecure, that without a good night's sleep, they're not as academically successful as you or I would want them to be. But what's your take when you hear a report like this?
Well, I think, first of all, thank you very much for the opportunity to speak on this panel on such an important topic. You know, most school districts will talk about sleep and having a good breakfast around standardized testing time. So it's obvious to us that we know that a good breakfast and sleep are important. We need to do a better job of making sure that we message that throughout the school year, because it's so important for brain development. With the landscape of early education changing the way it is, we have programs now in our area where children as young as 3 years old can start school. And so we have our 3-year-olds, we have our 4-year-olds, we have now universal pre-K programs in which everyone is invited to participate in our pre-K programs. And so we're located, of course, right across, we're a border city and very close to the International Bridge. So we see it. We see that families are traveling back and forth, if not on a daily basis. They have families that, and they're going back and forth. There's that sleep insecurity of not having a restful sleep that we see in the classroom. We really see it in our pre-K and our K grade levels where it's not a mandatory attendance. Those are our highest attendance area concerns. There's a lot of families that may keep their children at home, perhaps because the children did not have an adequate amount of sleep the night before. And so everything that you've talked about, putting children on a regimen and making sure that happens nightly, to take away the screens, to make sure that all of these things are happening. And we as school districts can also contribute to that by contributing the books so that they're reading that. Instead of asking for reading logs, we could also ask for sleeping logs and hold people accountable to really breaking this cycle of not having something in place for the benefit of our children.
Yeah. Veronica, I wanted to ask you, when we look at the impact of policy change, you and I both know that alleviating poverty goes farther than anything else that could happen here. But as always, our state legislature will probably want to focus on the time change stuff and when the school starts, because that's easier, maybe not as effective, but it's something. Talk a little bit about that, about what you see as what would happen if we didn't have a time change with daylight standard time, or what if you started your high schools significantly later than elementaries. Tell us about the time impact on children.
Well, certainly we can always, we know nobody has to tell us that daylight savings time has started, because we see the impact of our children are a little bit more groggy that week. And as we're coming back from spring break, well, anybody that was on a routine, they weren't during spring break. So we definitely see it. I think the less times that we would have to change, I think would benefit children. Absolutely. There are all sorts of factors to take into consideration about start times, even for our high school students. We know sleep is important for them, but then there are also the students that might have a job after school, and how is that going to impact the income that they're trying to provide for their family? So many factors to consider, but certainly consistency would definitely benefit all children.
Yeah, and logistics on that, right? For school buses on, I mean, it's a tough thing for some of those differentiated start times. Yeah,
absolutely.
John, you're in the El Paso. John Adams is the Director of Health, Wellness, and Physical Education for the El Paso ISD. John, from your perspective, I mean, what do you see the impact of insecure sleep on some of your kids?
Well, so again, I thank you as well for this opportunity to be on this panel. And so I think something in terms when we talk about living healthy lifestyles, sleep is probably one of the most underrated things. We talk about nutrition, we talk about physical activity, we talk about lifestyles, but sleep is so critical to that. So the time that we're sleeping is the time that our body is recovering, not just from physical stresses, but from the mental stresses. Our bodies are reestablishing things that happen throughout the day. And when we don't get that sleep, things like stress hormones, like cortisol levels, for example, they're increased during times of stress. And when do cortisol levels come down? When we're sleeping. So if our students aren't getting a good night's sleep, they're already stressed. Maybe they're having nutritional issues. They're hungry from the day. They're stressed out because they're not doing well in school, or they have a big game coming up. And so they're not sleeping. And so those cortisol levels never really get a chance to fully recover. So you kind of go in with a tank half full and it never really gets a chance to go to empty. So as those cortisol levels continue to increase day after day after day, those cortisol levels affect things like obesity and cardiovascular diseases and those kinds of things. And I don't think that gets talked about enough. I also think that when it comes to educating our students and our parents as well, I don't think people realize how much sleep is really required. I don't think a lot of people realize that middle school kids need 10 to 12 hours of sleep in the night. Who's getting that for their children? It's not happening. I just think if more people realize they really do need, of course, it's individualized. It varies from person to person, but the national standards for sleep for upper elementary to middle school kids is 10 to 12 hours of sleep. That's how do you do that? That's with all the other activities going on, everything else is happening. How do we get there? So I think that's a big concern.
Yeah, thank you very much, John. And do you, like Veronica, see big changes in regards to time with the kids when we have the time change? John?
Yeah, sure. I'm sorry. Yeah. So, yeah, for sure. I mean, I think establishing those routines, of course, it's going to vary from time to time, but having those routines are very important. And I agree with everything you said at the beginning, Dr. Bob, in terms of that family life is so important. Things that you do with your family, exercising as a family, having dinner as a family, and yes, going to bed as a family. So you may not go to sleep as an adult, but when you put your kids to bed, it's probably better to let's shut the house down. We're going to exit to our bedroom and do our things that we need to do there and get ready for better ourselves. And I think doing those things as a family is important, and maintaining, as Ms. Hill said, coming back from spring break and after those time changes, there's no routine. Those kids aren't following routines, and it's very important. Even on weekends, my son has friends. They stay up till 2 o'clock in the morning playing video games, and then they sleep till 1 o'clock on Saturday. So those changes in routines really do have a huge impact on the things that they do.
Sometimes wish you could get those days back when you slept till 1 o'clock on a Saturday.
Yeah, right. But thinking back on it, not really. Yeah. I mean, I wish I would have had a better routine as a teenager myself.
Yeah, exactly. Veronica, before we move to Español con Guadalupe, I wanted to ask you one last question. The impact of the pandemic on the well-being of our children is significant, right? And I was talking to Mike Morath yesterday from the TEA, and we talked a lot about how we can't, everyone wants to get back to normal, but for our schools, it's a lot of catch up. There's no normal right now. And this is a part of it, right? The good night's sleep we're going to have to do this if we want our kids to get back up to speed, which is not going to be immediate, right?
Boy, oh boy, is that ever true. We talk about the educational gaps that happened in these 2 years during the pandemic. And really, it was a break in the routine. Children all of a sudden were learning on their computer screens, and they were on their computer screens for a number of hours during the day when they couldn't come in, and it would just upset the whole routine of education. And so I think that this is a good time to hit the restart button and bring the importance of sleep to the forefront, and everything else that we're trying to catch up with after the pandemic. Our children are back in the classroom fully, and they need to feel safe so that they can go home and have their proper rest. But we need to do everything that we can to ensure that the safety of our children is still at the forefront, and that we are educating parents about this importance. And definitely, let's get back into a routine that's going to work for everyone.
Yeah, very good. Thank you, Veronica, very much. Guadalupe, para la prensa latino, algunas palabras en español, si puedes.
Claro, hoy estamos orgullosos de presentar nuestro estudio titulado Descanso y Resiliencia, donde exploramos la inseguridad del sueño en Texas y aquí en nuestra región del Paso. Mattress Firm apoya el buen dormir y estamos agradecidos por su colaboración en este reporte. La comida, la vivienda, la ropa y el sueño son necesidades básicas que todo niño merece tener cubiertas. Todos los padres quieren satisfacer esas necesidades básicas y entienden la conexión. Así como mamá nos contaba, dormir es importante para nuestro bienestar. El estudio nos muestra un número significativo de niños en nuestra región y en Texas que no duermen bien. Y sabemos que la falta de dormir perjudica el desarrollo, la salud y el bienestar de nuestros niños y nuestras familias y el éxito de nuestra región. La desigualdad y disparidad del sueño en el estado y en nuestra región es muy alarmante, así como lo damos en el reporte. El reporte también destaca recomendaciones para asegurar el bienestar de los niños a través del sueño. Recomendaciones para padres para asegurar que todos nuestros hijos puedan dormir bien, así como establecer un horario regular para dormir, hacer ejercicio, cenar juntos y sanos como familia, asegurar que el ambiente esté fresco para mejor comodidad mientras dormimos y controlar el tiempo que nuestros pequeños usan pantallas de tecnología para que puedan descansar un poco antes de dormir. Igualmente, destaca recomendaciones de pólizas para apoyar a los padres de familias en asegurar el buen dormir de nuestros hijos, así como pólizas que alivian la pobreza en nuestra región, que directamente contribuye a la desigualdad de sueño, y seguir apoyando los recursos que existen en nuestra comunidad, así como nuestras escuelas, así como el Distrito Escolar del Paso y el Distrito Escolar de Fabians, que apoyan a nuestras familias con las necesidades básicas que todos los niños merecen, y pólizas que eliminan las barreras que las familias puedan acceder a las necesidades básicas. Igualmente, los quiero invitar a nuestro evento el jueves que se titula Una oportunidad de luchar, necesidades básicas y éxito infantil, donde vamos a explorar los desafíos que enfrentan las familias de hoy para satisfacer las necesidades básicas de sus hijos, desde el acceso a alimentos, vivienda y el buen dormir. Hablaremos con expertos que atienden a nuestras familias, donde explorarán las soluciones que existen para satisfacer las necesidades básicas de los niños y aprenderemos qué podemos hacer para brindar que cada niño tenga esa oportunidad de aprender, crecer y prosperar. Tendremos interpretación en vivo en español durante el evento.
Gracias, Guadalupe. Mauricio, ¿nos puede hablar en español de la importancia de este partnership con Children at Risk y Mattress Firm?
Claro que sí. Estamos comprometidos a la comunidad del Paso. En este estudio, si se ven los resultados, era significante la deprivación de sueño de algunos de estos niños. Es muy importante el dormir. Como mencionaba el señor John Adams, cambio de rutina es muy imperativo para los niños. Es muy importante que descansen bien y estamos nosotros muy orgullosos de habernos podido asociar y hacer una asociación y un junto con Children at Risk, que es muy importante, especialmente para nuestra comunidad hispana. Los resultados, si se fijan, o sea, está significante en el lado de el hispano, la privación de dormir. Nosotros estamos comprometidos a la comunidad del Paso, especialmente Fabians, a saber que estos niños descansen bien. Muy importante que duerman. Mi papá, yo creciendo, era un dicho de él: hay dos cosas en la vida que tienes que tener, mijo: un buen par de zapatos y un buen colchón. Y de niño yo pensaba pues que es eso, que ya ahora de grande lo entiendo y ahora viendo estos resultados, creo que es algo que todos debemos de, como padres, un padre y yo de 3 hijos, poner nuestra parte para que nuestros hijos estén mejor y salgan adelante. Pues por eso estamos muy orgullosos de ser parte de este estudio. Gracias por permitirnos ser parte de este estudio. Se les agradece.
Muchísimas gracias, Mauricio. I love the advice of your father, right? A good pair of shoes, right? How great. So, Sharon, can you briefly, Guadalupe mentioned it in Spanish, but can you briefly talk about the summit that's coming up on Thursday that people can be a part of? You're on mute, Sharon.
Sorry, to take a deeper dive into our Rest and Resilience report, please go to childrenatrisk.org and you can register for our free virtual summit of Fighting Chance, Basic Needs and Sleep. And you'll hear from experts about the study. You'll hear both an explanation of the issue and hopeful solutions to help our kids and families get better sleep.
Very good. Thank you very much. I want to thank all of you because our teams and our people like us all across the state, what we want is for children to be successful. And when our children are successful, our state is significantly more successful. And that's what it's all about. We're all proud Texans. We want our kids to do well and to make our state proud. And this is one of many elements that we need to work on to make sure that our kids are successful. But I love that this is a new lens from which we can look at the success of our children and another way to keep talking about the things that we need to do to make sure that every single one of our children can be successful. So Veronica and John, thank you for all the work that you do in our schools. It's so appreciated. It's underappreciated by many people, I can tell you, but I'm telling you that the work that you do is transformational. So thank you. And Mauricio, so thank you for the partnership as a good corporate steward. Mattress firm is, we're very proud of that partnership. So thank you all very much. Charmalie, Guadalupe, Sharon, we thank you guys and sleep well, everyone.
Thank you.